Welcome you all to the Women's Health and Harmony series. Last time we learned about basics of infertility, and this particular session today we are going to discuss about intrauterine insemination. This is one modality of treatment which is practiced all over the world by most of the gynecologists and infertility consultants before taking the patient finally for testing baby or in vitro fertilization. This procedure carries average results. Now there are many reasons why do we take these patients for intrauterine insemination or COS with IUI, and some of them are that these patients are infertile, that they have unexplained infertility. Many of them have cervical factors. Some of the patients have subtle male factors. In cases of early endometriosis, also many other factors that we usually indicate intrauterine insemination. So when we actually have to this procedure, the results are optimum. They are not great, and almost to the tune of around 12 to 18% per any given cycle. But you need to actually have a proper selection of patients, use the proper induction of ovulation protocols, then time the ovulation by an trigger injection which is given to trigger the ovulation, followed by proper preparation of the semen sample which is collected from the husband, and then insertion of the semen sample into the uterine cavity bypassing the cervix. So these are the issues which are involved in optimizing the results of IUI, and this particular procedure is practiced by most of the gynecologists, and we will go into the details of IUI procedure. There are many factors on the basis of which these IUI results depend, and certain factors of the age of the patient is one important factor. In a younger patient, the results are far more better. In a patient less than 30 years of age, the results are almost to the tune of 18 to 20% in a properly done IUI cycle, whereas a patient who is more than 40 years of age, the results drop down to almost 4 or 5% per cycle. And often it is said that IUI is not an ideal procedure of choice advocated for patients beyond 40 years of age. So age is one factor. Then the duration of infertility is another factor which governs the IUI results. If the infertility duration is less than 5 years, then the results are very gratifying. Between 5 to 10 years, the results are moderate, and beyond 10 years of infertility, in whatever indicated patient that we do IUI, the results are not that excellent. IUI success rate will also depend on the type of protocol that we use for induction of ovulation. Suppose we use only oral tablets for ovulation, then the success rate is only to the tune of 10 to 12%. Whereas when we start using oral tablets followed by injections, then the success rate brings up to around 18 to 20% per cycle. And after having used gonadotropins, then you must time the IUI. So to time the IUI, the injection which is given to trigger ovulation, the IUI is timed around 24 hours to 40 hours when you do one single IUI, and it is timed at 24 hours and at 48 hours when we do 2 IUIs. So when we do 2 IUIs, or when we resort to 2 IUIs, the success rate is far better. Another factor on the basis of which the success rate depends is the final semen analysis or post-wash semen count. So if the post-wash semen count is reasonably good beyond 10 millions and a motility beyond 20 to 30%, then the IUI success rate is far better than a patient semen where the count and motility is far less. So these are the issues on the basis of which the IUI success rate depends. And the only drawback of the IUI is that sometimes with high dose of gonadotropin, there is always a chance of developing multifocal pregnancies or twin gestations, and there's a small little increase in the risk of ovarian hyperstimulation syndrome. We can do either 1 IUI or 2 IUIs in a given cycle. If we do 2 IUIs, then we usually increase the chance of success rate by around 5%, and usually we resort to doing 2 IUIs if given a chance. So when one single IUI is done, the IUI is timed between 32 to 40 hours after the trigger injection, and if there are 2 IUIs which are performed, then the first IUI we do at 24 hours and the second IUI we do at 40 hours. The number of IUIs we do in a given patient also will give you idea about the success rate, because this is what is called cumulative success rate, and cumulative success rate following 3 or 4 IUI cycles in a given couple would increase up to around 50 to 60%. So around 60% of the patients who are taken for IUI procedure will conceive at the end of 4 cycles. The success rate of IUI in a given cycle is anywhere from 12% to 80%, and the cumulative success rate will increase up to around 40 40 to 50%. So that is something which is very gratifying. The next factor which is important for IUI results is the semen preparation. There are 3 or 4 techniques of semen preparation. The most commonly used semen preparation technique is known as swim-up technique, and the second one is known as density gradient technique. Now, in both these techniques, what we really do is that we remove excess of fluid which is present in the semen. Then we remove all dirty and dead sperms which are present in the semen sample. And this particular semen post-wash is enriched with very high quality healthy sperms with culture medium or flushing medium. So a post-wash sperm, if it is properly done, will also determine the success rate. The success rate of IUI will depend on is the actual procedure which is carried out. So this is a high-tech procedure where the patient should be either in the theatre or an IUI room. She is given the dorsal position or lithotomy, and she is brought to the edge of the table. A self-retaining cusco speculum is inserted inside, and the external os of the cervix is exposed. All the entire procedure is done with proper aseptic precautions, and a loaded IUI catheter with the semen in the syringe is directly placed beyond the cervix through the external os into the uterine cavity, and then a post-washed semen is which is prepared and which is present in the syringe is injected inside the uterine cavity, bypassing the cervix over a period of 1 or 2 minutes. And after having injected the entire semen which is present in the syringe is held in position for a period of 1 or 2 minutes, so that the sample which is present or pushed inside the uterine cavities doesn't flush out through the cervical canal, and then the IUI cannula and the syringe is withdrawn. After the IUI procedure is over and the follicular rupture is confirmed by a transvaginal sonography, it is usually common practice by most of the gynecologists to put the patient on luteal support. Once we put this patient on luteal support, we wait for 14 days, and if she doesn't get her periods at the end of 14 days, we do a urinary pregnancy test to confirm whether she is pregnant or not pregnant. And if she is pregnant, then we continue with luteal support and then do a transvaginal sonography at the end of 6 weeks from the last menstrual period to find out the fetal viability. So friends, the success of IUI will depend on proper selection of patients, then properly use protocols for induction of ovulation where we use gonadotropins to increase the success rate, then properly timing the IUI and performing the procedure as per the ideal, and a proper semen preparation. So everything will matter as far as a success of IUI is concerned, and all these procedures should be done in one particular center that will improve the outcome.